Okay, so in terms of moving on about giving the advice, so obviously there's nice guidance around brief advice, and that also includes if you're not meeting the physical activity guidance that you might want to give brief advice. There's also, I think there was a recent statement by Prof Whitty during one of the kind of TV elements where he talked about that actually no matter how old you are, what health conditions you have, that actually exercise is beneficial. And I think that was really important to hear on a kind of public stage. And I think a lot of people agreed with that. There was no one that disagreed with it. And we, you know, as the four of us know from a lot of the teaching that we're doing, we know that 1 in 3 men and nearly half of women are not achieving the current government guidance, the CMO guidance. And actually there's a problem with nearly half of those with long-term conditions also not achieving enough for good health. So there's a lot of people there that are not active enough. So I guess in your own clinical roles, I'd be really interested to know how the kind of patients you're giving brief advice to particularly, and how you kind of doing that at the moment. So I'll go to Sarah first, if that's all right.
Well, the website that I have learnt about since doing this role, which I didn't know before, I don't mind saying, is the Moving Medicine website, which has completely revolutionised my consultations. It is a fantastic resource. If you have a look at the Moving Medicine website and click on prescribing movement, you can click on various illnesses. So if you've got a patient who has got dementia, you can click on dementia. If you've got a patient who has got ischemic heart disease, you can click on ischemic heart disease. And you can get a tailored 2-page infographic that you can print off in seconds and give to the patient, which is a lovely starting point. And as my colleagues have said, you can actually give them that to take home to continue the thought process to discuss with their family. And I think it makes such a difference, because previously I think I would say to people, oh, you know, exercise would help you more, but then sometimes they would look at you funny because they've come to tell you about their depression and you're telling them to go and do some swimming, and they don't actually get the link. Whereas actually if you give them a depression leaflet that says it will help their sleep, it will help their motivation, it will help them become less anxious, then suddenly it really, really makes sense. So whether it's for mental health or physical health consultations, I love that website. I tell everybody who I meet about that website. And sometimes in a surgery with 12 patients in the morning, I would give pretty much all of them a Moving Medicine leaflet because they are absolutely wonderful.
Perfect. So that's movingmedicine.ac.uk. And so that was a partnership between the faculties, Sport England, Public Health England. So yeah, great resource. So do check that out. Great. And then, so Josh, tell me a little bit more about how you're currently doing and particularly the patients you're seeing as well.
Yeah, so I think in a mental health context, again, as Sarah was kind of alluding to, I guess some people don't necessarily expect to be talking about physical activity within a sort of talking therapy setting. However, as I said, we know that particularly when we're talking to people who may be suffering with depression, a lot of the symptoms of depression are things like reduced motivation, reduced activity, withdrawal, kind of less enjoyment from activities, less, kind of achievement or sense of achievement. So I guess we're often bringing it up in that context to think about this is actually a really good way to deal with some of those really common symptoms of depression that we can experience. And again, we know through kind of a structured exercise program or kind of getting more active, again, we can start to feel like we have more energy. Again, we can improve sleep. We can really address some of the things that people are actually coming in to talk about. And that's not to say that we wouldn't also be thinking about some of the other psychological factors that are playing a role in their depression, but it can certainly be a big part of the kind of the behavioural aspect of the treatment that we're focusing on. So and it maps on so well to what we tend to do in sort of a change focused psychotherapy, which is very much, again, behaviour change, trying to address the symptoms that are coming up. So yeah, I talk about it with most of my clients in those settings.
And I think some of what you talked about, that's just as relevant to many people working in a variety of specialities from primary and secondary care as well. So no, that's useful. And Michelle, tell me a little bit about the patients you're seeing particularly, and then the way you're kind of using brief advice with them.
Mainly the patients I see with diabetes. I go about using the sort of ask, explain, advice kind of model and brief interventions, and signposting to resources such as things like the We Are Undefeatable, where they really start to see people with the same condition as themselves that are being able to make changes and really putting them into normal life and being fun and being practical. So I use a lot of the We Are Undefeatable resource, and about just making sure that they understand that being physically active as they each can be is one of the key elements to improving their health, and with diabetes obviously getting themselves to targets in all different range of fields.
Great. And I think so, some of you guys are obviously now starting to talk about resources you use, which is great, because I think ultimately, what are the tools in our toolbox for a consultation? And for many clinicians, there's lots of things to learn. Physical activity is obviously one component of that, an important component, but one component. So I think Sarah's already mentioned moving medicine. Michelle, you mentioned the undefeatable stuff. So I thought it'd be nice to explore that in a little bit more detail. So Sarah, I'll just come back to you about the moving medicine. It'd be great to know how you use it and what your thoughts are about when to use it and so on.
So I would typically ask somebody what their level of physical activity is, and then I might ask if it's okay to talk to them a little bit more about that. Quite often I try to use a motivational interviewing type of approach to try and get them to come up with ideas about what might work for them and how they might feel if they've done more physical activity, why that might help their symptoms. And so I would probably have a little conversation first, and then I would take them to the website. And actually, so quite often somebody might have 2 or 3 different problems, and each of them could be benefited by increasing their levels of physical activity. And then sometimes it can be quite powerful to actually say, look, you have got depression, physical activity will help that. You have got diabetes, physical activity will help that. And you have got ischemic heart disease, and physical activity will help that too. So actually, it's a real bonus if you can focus some energy and effort on this strand, because it will have so many positive benefits for all sorts of different problems, and really benefit your well-being. And I just try to be really enthusiastic and optimistic, and help support people to the point when they can find something they enjoy. And I talk quite a lot about enjoyment. There's no point in doing stuff if you don't enjoy it. It may be good for you, but you may not keep it up. Whereas if you can actually find something that you're keen on, if you used to enjoy, I don't know, dancing, and then you take up dancing again, you're far more likely to stick with that. And of course, there are many social benefits to taking part in classes. You can make new friends, you can learn new skills. We know it's good for the brain, for older people especially. I do a lot of work with frail elderly people. And actually, all of those things are side benefits, as well as the core benefit to the cardiovascular or mental health system.
Great. So again, we've already talked about moving medicine. So again, do have a look at the resources out there and see what you think. I always think my take on moving medicine is make sure you've had a good look around the website and you're happy with how it all works. And then it becomes very easy to use with the patient next to you. So again, do have a look at that. And Sarah, the other points you make, I think, are really valid around finding something that someone enjoys. And actually that requires us talking to them and listening, and not necessarily telling them what to do. So I think they're really valuable points to get across.